And we want to begin this half hour with updates on the pandemic, specifically in a part of Western New York we don't typically focus on as much, Chautauqua County. While not as populated as Erie County, cases there have also been on the rise in recent weeks and months. As of Monday, the county had a positive rate of more than 12%, putting the county in that high-risk category. And here to talk about that tonight is Chautauqua County Executive P.J. Wendell. We're glad to be able to talk about what's happening in Chautauqua County right now. And we want to start with the rise in recent cases and hospitalizations. What is the situation as far as what the health department is seeing right now, and how are hospitals able to handle it?
Well, Kate, it's a great question. We're watching and monitoring this closely. One thing I want to discuss, we look at a 12% infection rate. That does not mean 12% of our population are currently positive with COVID. Those are based on the number of individuals we're testing. So I want to make that a little bit clear. So with 127,000 people, we're not looking at, over 10,000 people with COVID. Our active number of cases is over 700. Alarming, we're monitoring that. But again, just a little clarity. I did take a tour yesterday of our emergency department. I worked there years ago as a volunteer. I'm usually in and out of that emergency department quite often. And they're bursting into seams. Contrary to what the Buffalo News read in their editorial, we're sending patients to Erie County. We beg to differ. We are getting more. We have a county in the north, a hospital in the north of our county. When they go on delay, we're seeing many of those northern county emergency ambulances coming down to Chautauqua, lower Chautauqua County, or the southern part, to UPMC. So we're seeing Cattaraugus County coming when Olean's on a delay. We're also seeing northern Chautauqua County coming down to UPMC Chautauqua. And since that hospital is affiliated with UPMC Hammett and UPMC out of Pittsburgh, the likelihood of us sending our sicker patients to Buffalo, although it may happen, it's usually unlikely to happen just because our hospital systems are to the south of us. That's not to say that Chautauqua County patients aren't going north on their own to seek treatment, depending on where they live. But again, we're not sending our sicker patients, to the Erie County hospitals as may be thought.
You're still dealing with these higher numbers, and time and time again, we speak with doctors on this show. They're all recommending people get vaccinated, and those who have been vaccinating get their boosters. And right now, Chautauqua County is among the lowest in the region for those vaccine rates. According to the state's vaccine tracker, nearly 59% of Chautauqua County residents have gotten at least one dose of a COVID vaccine. Given that the cases are on the rise, there's a new variant out there. What is your message to unvaccinated residents in Chautauqua County?
Well, I had a great message from a mother who shared with me. She was concerned, her daughter's of special needs, and wasn't sure what would happen should her daughter catch COVID. And they did. They both tested positive before Thanksgiving, and the vaccine worked. A doctor referred this to me that we have to look at the vaccine like a seatbelt. We're not saying you have to get it by law, as you do have to wear a seatbelt, but a seatbelt will protect you. If you get into an accident, that seatbelt will save your life. Now, do people die wearing a seatbelt? Certainly, much like people may get the virus and succumb to that are fully vaccinated. But it will serve its purpose and do what it's supposed to and intended to do. This mother shared with us that her daughter had mild symptoms for 2 to 3 days, and they're well on their mend, and both are doing much, much better, and wondering what would happen had they not been vaccinated. So yes, we will hear the stories of what has happened in negative respects to the vaccine. But when I hear a mother sharing a heartfelt story as to how the vaccine worked, when I know of people my age in their early 50s who succumbed to COVID, those are tragic, and we need to do it. And I have to urge my residents strongly, please get vaccinated. Our doctors are sharing this. There'll be new messaging coming out from our department and the health department tomorrow or on Friday. Again, continuing to urge our residents to get vaccinated. The vaccine is working. And I know as soon as I say that, there are people out there that will dispute this, and I'm sure my email will be blowing up. But the data that I'm seeing from the science, the vaccine is working. It's not stopping you from getting COVID. It's stopping you from getting sick and the intensity of the virus affecting each individual.
With you talking about, your inbox blowing up, I want to talk to you a little bit about strategies because we've already seen Erie County re-implement its mask mandate for public indoor spaces. That was just a few weeks ago. We know that certainly that's a controversial decision. Is there anything being considered to slow the spread in your county right now, whether that's a mask mandate or maybe another strategy? And when you're dealing with this rise in cases, that continued vaccine hesitancy, what kind of conversations are you having about how do you manage that all?
Well, it's exactly your point. We do discuss this daily with my COVID team, is how we manage that. I think, if you go back to the governor's press conference last week when asked by a reporter from PBS, the counties that have mandates understand the mandates. And those that don't know why they don't have the mandates. It's a matter of the position. And even the governor said it. People that have made their decision have made it. And it's very difficult, and her words were almost impossible to enforce mandates. So again, we're considering these every day. We're looking at what point, and my team discussed it today, at what point do we look at a state of emergency? But the state of emergency doesn't stop any of our residents. It doesn't change anything. States of emergency access, things from the state allows us to procure resources in a different manner, faster, quicker. But right now, the governor's declared a state of emergency. And, right now in our county, we're going to monitor things as we see, the numbers rise. And should we have to change our strategy, we will. In fact, we have a strategy we're working on right now, and we're discussing, and hopefully that'll be out in the next day or two. But, we are working together. We're looking at a regional approach to this as well. I reached other county leaders about, changing and bringing on a new strategy, So we're looking at these things, and we're going to continue to look every day. This changes daily. So, what happens today may be different tomorrow, and we're going to, focus on the safety of our residents. I want to remind people, whether it's myself, County Executive Poloncarz, County Executive McMahon in Onondaga, or McCoy in Albany, or Steve Newhouse in Orange County, nobody has lost sight of the safety of our residents. We all realize, we look at those numbers, we see the death rates, we see people dying, and we take that to heart, every single one of us. So I don't want people to think that, we're changing focus and we're looking at the dollar. We're looking at this every day, and no one has stopped caring about our residents. And we're going to do what we can to make sure that they're safe. And decisions we make may not please everybody, but we're going to do what we feel is the best for the overall well-being of our counties.
We appreciate your voice in this conversation. Chautauqua County Executive PJ Wendell helping us explore the COVID effect in that region of Western New York. Thank you again for joining us tonight.
Thank you so much.